Our guest of honor, Dr. Shetty, distinguished panelists and members present here. Good morning to everybody. As a journalist and as a journalist from Mumbai, as I was just coming up to this conclave, I was trying to think of, where it touches people. And just to give you an example, about 2 months ago, the Mumbai Press Club launched a medical insurance program with the New India Assurance Company. We just felt that it was not, there was not enough being done, and we wanted to test the waters, how many people are covered. The general impression I had was that most people and most companies are covering their employees. So we thought we'll get about 100 people. And New India Assurance, the package was very good, nearly 50% of the regular premium with no checkups, and extremely good package. And you'll be surprised, within 2 weeks of announcing the package, about 350 to 400 journalists had enrolled. Some of them who had already been covered were increasing the cover, giving a little more premium and increasing the cover, purely because people are absolutely scared about what the future holds for the medical future holds for them. Another instance, we did a similar sort of package trying to understand how many people have access to health care, and allowing for a package with Seven Hills Hospital for journalists across Mumbai. And within an announcement of like a week, we had about 500 enrollments. To those who wanted to access Seven Hills, which is situated in a pretty sort of desolate part, in a part of Mumbai which is not easily accessible, and people willing to go there and do their checkups. This is the kind of greater consciousness that is sort of coming up in regard to medical and health care. Something which, on the surface is not available. Newspapers don't think it's very sexy. Earlier on, there were reporters who were assigned to this beat. You find very few reporters assigned to it, very little space, very little content coming. But under the radar, you see a great appreciation and a great concern about where this whole area is heading. Today, we are at the crossroads, and a very distinguished set of panelists are before you. A very distinguished gathering is here to debate this very important issue. But really, do we have a healthcare policy? Today, apparently not. We had one in 2002. It was earlier on kicked off in 1983. We were supposed to have a national health policy this year, but somehow either those in power or the government has not given it enough importance. And that is why forums like this are important, to debate and push the agenda that what this country needs is a comprehensive national health policy. We see the scenario is very clear. All the people who are in this hall who have been sort of debating this issue know the figures. We were spending hardly 0.94% of GDP in the 10th five-year plan. It went up to 1.08 in the 11th five-year plan. And the target is 2.1% of GDP, 2.5% of GDP in the 12th five-year plan, where internationally, any social welfare state believes 5 to 6% is what should be spent of GDP on this very, very important subject. It's just not being done. So what's the problem? The problem is manifold, but again we come back to the traditional analysis, and that's what should be hammered home. That it's not just people falling sick or diseases being rampant. There are issues like malnutrition. Today there are 1 out of every 3 kids which is malnutritioned in the world is in India. There are as many as 50 to 60% of our children across the country where malnutrition is playing havoc. If you don't get proper sustenance, don't get proper water, you're bound to fall ill. And this is a basic background every doctor, every medical administrator knows. 1.7 million children die every year before they are 1. These are startling, shocking statistics which we are still grappling with for years, for decades, and there is really no answer. Of course, the government has come up with the Rashtra Swasth Bima Yojana, A lot of work has been done. It is not that government is blind or deaf to these issues. But what this kind of a conference is arguing is that we've got to do more. Basic issues are actually not, it's not that we have to administer drugs. It is not that you have to set up hospital. 50 to 60% of the problem can be solved by providing proper nutrition, by seeing that sanitation is proper. Today, 68 to 70% of persons in this country do not have access to latrines. 50% deficiate in the open. Tackling mass diseases like TB, etc., does not need specialized hospitals. It needs concern, reach, and a very sensitive government. So these are the things which also a conclave like this should handle, should actually put their fingers on. The Modi government has been very keen to handle this. National health insurance policy has been developed, but what should be done and what can be done, it is definitely falling short. As per election promises, there was to be a complete medical insurance as well as free drug kind of a policy covering all 1.2 billion members of this country, people of this country, and that has come to a standstill. It was, I mean, the National Health Assurance Committee, which was set up, put a budget of 25.5 billion to it. It was cut down to 18.5 billion, and finally, because there was no money in the kitty, or it couldn't be stretched out, it has been put on hold. And there is various sort of subsidiary or, short-term measures being kind of proposed, but ultimately, it has to be a national cover. Countries like Bangladesh have done much better. Countries like Sri Lanka have reached out far more into the population. India can do the same. We also welcome all the various corporate groups which are making a big difference. It is not that we have only public hospitals. The public hospitals must be there. Proper public health care has to be there. But at the same time, specialized treatments, specialized disease treatments, and specialist hospitals, specialist medical care is also a need of the hour. And on that front, I think we've made great progress. Some of it Mr. Batra has already outlined, but ultimately in a country like India, which has multifaceted kind of population, different segments, you have to have different segmented medical care also. The problem is that because the public care part has been sort of deficient, it has been a great pressure on the corporate side. And it is it's become a sort of a cultural problem where people aspire to avoid the public sector medical and healthcare system and go towards the private sector, feeling that that is a more efficient system. It could be, but the point is this calls upon, or this puts pressure more on the government to create a functional and a responsive healthcare system. So both sides have to exist, both sides have to flower, and I think a conclave like this ultimately must debate these issues at length, and we bring out some kind of a white paper on this, and BW carry this forward and make it an agenda, an ongoing agenda, not just one conclave, but in repeated issues, bring this up and see that the government responds. Thank you so much.